So good morning, everybody. We may have a few more people popping in. We had a few more people who said they were going to attend, but we want to get started and appreciate Dave Cruz and Peta-Gaye Porter for putting together this great presentation on their healthcare partnership. You will hear from them a little bit about how the partnership got started and how they structure it and have the opportunity to post questions during the session, which they will address at the end. So please do, by the way, this is Karen Shack. Sorry, I forgot to introduce myself, from Commonwealth Corporation. We're keeping everybody off video initially and muted till we open it for questions at the end. So just a reminder that this session is being recorded. So we will be able to send out the recording along with the slide deck after the session. So if there's anybody you work with who didn't have a chance to attend, please feel free to share this with them. This is going to be a great presentation from staff from the Hampden County Workforce Board about a healthcare partnership that they have had in place for many years, I think close to a decade. And it's been an incredible resource for them around engaging with employers and education and training providers to help set regional workforce strategy. So I invited them to present on this because each of you is working with your own network of employers and training providers as part of the Healthcare Hub. Some of you have partnerships in place that you're continuing to sustain during the Healthcare Hub's grant, and others of you are really kind of rebuilding partnerships to include healthcare employers and trainers, training and education providers, in order to really get a good sense of what's going on in your region and help make sure that everybody who's critical is at the table to have these conversations about what the workforce needs are for the healthcare community in your region at this time. And so I asked them to present on this because it's an amazing model of how they've sustained ongoing connections and relationships and utilized these relationships with their local healthcare employers and local healthcare education and training providers over the course of a decade. And they've really used this partnership to set strategy for their region in a very successful way. So this is an incredible model. And I wanted you to have the opportunity to hear from them about what the model does, how they use it, and be able to ask questions. And just a heads up, I'm working with the North Shore, the Northeast workforce regions to do a presentation as well about a manufacturing partnership that plays a similar role. And so we're going to have that scheduled for early March. So it'll give you another opportunity to hear another example of how to use an industry partnership to help you set some workforce strategy for your region. So I will now stop my intro and thank Peta-Gaye and Dave Cruz. And Peta-Gaye, you will take it away. And please remember to put questions in chat all along, and Peta-Gaye and Dave will take those questions at the end of the session. Okay, thank you.
Alrighty, thank you everyone. Thanks, Karen. So my presentation today is about building and maintaining a partnership beyond a single project, as Karen spoke about, and the name of that project is the Healthcare Workforce Partnership of Western Massachusetts. And my name is Peta-Gaye Porter, the program manager for the partnership. So I'll just go over our webinar objectives just to give you an idea of what we're going to review today as a part of this presentation. So we're going to present an overview and history of the Healthcare Workforce Partnership. I'm going to describe the partnership structure and the role of the Workforce Board. I'm going to provide a description of the 3 subcommittees that makes up the partnership and discuss some of our recent and annual projects and activities. So the Healthcare Workforce Partnership of Western Massachusetts is a collaboration among employers, workforce development, training and education providers, community-based organization, grant funders, and they're all working together with the shared mission of strengthening the region's healthcare workforce and enhancing the quality of patient care. And that mission goes across all three subcommittees. So we're all focused on exactly the same thing. I want to mention that our program, our initiative did not just evolved overnight. It took time, it took years, it took multiple grants over a period of time to build into the initiative that it is today. But I also wanted to talk about some of the key ground grants that kind of that was in the early stage of building the initiative. So a very brief history of how our members work together to build our partnership. Included in 2006, they secured a partner investing in nursing grant from the Robert Wood Johnson Foundation. In 2007, they implemented a STAR faculty development funding program, and that was funded also from the Robert Wood Johnson Foundation and the Massachusetts State Office of Workforce Development. And this was focused on training BSN prepared nurses to become faculty educators. Then in 2008, Bay State Health, our acute care organization here, two of our large acute care organization, Bay State Health and Sisters of Providence Health System, at the time is now Trinity Health System, they receive the Workforce Competitive Trust Fund grant to continue to build the partnership. And this was with funding from the Commonwealth Corporation. I will share with you, I think it was pretty interesting so this is actually a slide taken from the proposal that was shared back in 2008. And so I just want to share with you what the vision was back in 2008. And so they were going to call the project the Springfield Holyoke Workforce Development Initiative in Healthcare. And their vision was to have a collaborative alliance between healthcare industry employers, community organization, and educational organizations that provides Pioneer Valley's workforce diverse residents gainful employment in hospitals with abundant opportunities for both current and newly skilled workers to achieve economic self-sufficiency. And there were two components to this grant. One was building a partnership, and the other one was the CNA training program for acute care settings. And so that was in 2008. I just shared what their vision was in 2008, but the work towards the partnership actually began in 2006. And so we are 14 years strong, which is pretty exciting. So it's been active for 14 years. We have over 30 organizations that are involved in our committees or activities. We have over 100 individual member participants serving in different capacities. There are 3 distinct committees. We have a memorandum of understanding and a project manager, a full-time project manager. This is what our landscape looks like. I wanted to show you basically some of our lead partners, some of our founding partners that have been involved in the initiative for many, many years. And I also want to show you what holds us together. So we have a shared mission. Everyone that you see that are involved in our partnership have a shared mission, and that is to build a skilled healthcare workforce to deliver quality patient care. So our mission really hasn't changed, and our vision really hasn't changed either. And this is our governance structure. So as you can see, we have our Healthcare Workforce Board, Advisory Board that oversees the 3 subcommittees. They're the Western Mass Nursing Collaborative, the Allied Health Committee, and the Pioneer Valley Interprofessional Education Collaborative. And I'll share more on all 3 committees further down. We'll talk about each one more. I will say that you see that here at MassHire, our role is to manage these 3 subcommittees under the direction of the advisory board. So I think at this point, I planned on sharing our MOU. So I'll take a moment to do that. I'll switch share for a moment. And so this is our current MOU. It's running from June 2020 to, from July 1st, 2020 to June 30th of 2022. So it's a 2-year period. And in it, it lists all of the different groups and their roles and responsibilities. I just wanted us to take a look at that a little bit. And so this is a live MOU that is currently active. And it shows you the membership who makes up the advisory board. Yes, you guys can see that. It shows you who makes up the advisory board. And then it shows you also the roles and responsibility of the advisory board. So we expect that the chief executive officer or a designated person attends the advisory board meeting and give us guidance on overall direction and policies of the partnership. And then with the Western Mass Nursing Collaborative, we have the collaborative is made up of chief nursing officers and deans. So chief nursing officers in the healthcare facilities and dean in the educational facilities. And their role is primarily to identify issues pertaining to nursing education, student placement, and employment. And we have the Allied Health Collaborative, and they're a little bit more dynamic. That group is very large and it's very diverse, but the role of the Allied Health Collaborative members is to identify issues pertaining to allied health education, student placement, and employment. Our newest group is the Pioneer Valley Interprofessional Education Collaborative, and they are responsible for identifying and compiling resources to support interprofessional health care education, to increase participation of students' involvement in interprofessional education, and to promote best practices in interprofessional education and collaborative practice. And here is us, the MassHire Hampden County Workforce Board, and I'll take some time to go through our role and our responsibility. So here in the MOU, it states that we serve as the administrative and fiscal agent in this system. And we're responsible to identify and secure financial resources to advance the mission of the partnership. We are to provide oversight of sustainability funds provided by the members. We serve as a fiscal agent for the region's use of the centralized clinical placement system. If we have questions about that, we can talk about that later. We manage vendors and contractors as necessary, including payment processes. We coordinate project implementation. We leverage federal and state training dollars to support partnership activities. We facilitate meetings, decisions, activities, including developing meeting agendas and materials to produce documentation as necessary. And a little bit about how we maintain our partnership, the sustainability of our partnership. So what we do here is that it was established several years ago that the partners, seeing the investment that they have put in so far, and they saw it as being valuable, and they wanted to continue to invest in it and to maintain the goals and the outcomes of the work that they're doing. And so what we decided to do was to have the partners voluntarily contribute to the partnership on a yearly basis. And their financial support includes the support of the MassHire Hampden County Workforce Board to maintain the infrastructure and as well as staff salary. And a small portion of that also goes to cover their CCP, centralized clinical placement fees. And you can see we have here outlined the invoice date and payment dates for the educational facilities and the healthcare facilities. I'm moving away from this screen and I'm going back to the PowerPoint. I will say also important is that the MOU, in the MOU I just shared, we outlined the different timelines for the educational facilities and the healthcare organizations, and we came up with that timeline based on what they provided with us, and it was pretty much based around their fiscal years, and they gave us a timeline that would meet their needs, and it's been working. We've been doing this for, I believe this is our 10th year, and it's been absolutely successful. Other thing that I did want to share, as I was putting this presentation together, I think about the MOU and how formal it looks. And I think one of the things that I reflected on as putting this presentation together is that the MOU, it's on paper and it seems very formal, but the manpower behind it is the members of our committees, and just wanted to like reflect on how dedicated they are to the project and the program, because all of this is built on membership and it's voluntarily, but they are absolutely committed. They're 100% involved. They're highly engaged. They're very resourceful. Much of our membership has grown through their connections. You know, they've invited other members, they've made connections with us consistently. So I think that's just phenomenal. And so I was talking about how the MassHire Hampden County Workforce Board fits into the partnership. And I also thought it was important to even reflect on how the partnership becomes a part of the MassHire Hampden County Workforce Board, that there is just this real easy fit between both. And so one of the things is, even just looking at the slogan, the MassHire Hampden County Workforce Board slogan is building a better workforce. And we adopted that slogan as a part of the partnership, and we just say building a better healthcare workforce. And so we keep that going. You can see here the strategic plan priorities we've incorporated into our work, much of the same activities in ways such as we do conduct employer and workforce needs assessment. We do deliver programs on college and career pathway preparedness, and we do have a special interest, and we have dedicated projects that are tied to prioritize occupation. Most recently, the Workforce Board completed their Pioneer Valley Regional Planning Blueprint, and much of the work that we've completed as a part of the Allied Health Group is pretty much embedded in that work and tied to it then and now. We continue to work tangentially together. And this is our impact strategy. And so it is to build on our strengths and our resources, and to take the long view and to be inclusive. Our outcomes are achieved through the partnership as well as through our strategic plan implementation. And we'll talk about the 3 workforce groups. So the Western Mass Nursing Collaborative was established in 2006. And I would say when we're talking about the Western Mass Nursing Collaborative, the key thing to remember here is nursing. So this group stands out because we're really focused on one occupation, and that occupation is nursing. And earlier, when we looked at one of the first slides, one of the things that we realized that one of our first grant projects that laid the foundation of this initiative now was a nursing grant. And that work has been maintained over time. And so this collaborative has been in existence for 14 years. We have a strategic plan. This is our 3rd strategic plan. Our most recent one was updated in 2020, which we're pretty proud of. It was updated in the year of the nurse and the midwife, and the world on a whole celebrated nurses and the work that they contributed to our health and our existence. I think we were just very proud of the work that we've accomplished last year. It looked a little bit differently. We normally meet 12 times a year. We have a meeting on the first Thursday of each month. We keep that consistent. And in March, the end of March and April, we decided that we're going to increase our meetings. And I would say that at the end of the year, we had, I didn't count, I would say about 20 meetings that year, just really iron out issues around everything. You know, you guys are familiar within the healthcare systems and within education, but everyone who are a part of our group had someone to call or to speak to and just troubleshoot all different kind of issues together. So that was pretty spectacular, I think, for everyone. Let me see, what else should I share about this collaborative? I will say, this is great too, that all of the founding members are still a part of the collaborative. We've grown over time. We've always had long-term care. We have the 4 acute care systems, the large systems in the area. They're all a part of the collaborative, and we've only grown. We've not lost any members. The education partners, we've grown. We had our most recent member is Bay Path University. they just started their nursing program, and a part of them starting their nursing program, they decided they wanted to be a part of the nursing collaborative. And we've always struggled with maintaining long-term care and home care partners. And so they do evolve over time. That's a struggle that we have, and that's tied to the change in administrators. But as far as the education partners and acute care systems goes, they have been pretty consistent because they've had transitions as well. But something that they have maintained is that in the process of transitioning, they've always identified someone to remain on the collaborative. And this is something that they're voluntarily contributing to the sustainability each year, but they're putting in the work. They're showing up for the meetings every month. And when we increase the meetings, they're there as well. And when they're transitioning out, they're identifying people to replace their position and to make sure that their organization is recognized and is a part of the collaborative. So it's a great experience. The Allied Health Group. So I did want to share a couple of things about the Allied Health Group. So the Allied Health Group was established in 2010, and that their main focus is to look at high priority occupations in the region. And you can see on the slide that we've prioritized nursing and PAs and NPs, but we pretty much moved these discussions into the nursing collaborative groups, and we focus more so on the other allied health occupations. And we've conducted a number of occupational gap analysis reports, and the most recent one was completed in December of 2019, and that focus was on medical assistance. So if you think about our focus as a part of the hub grant and as a part of the regional planning, you can look at our priority occupations and see that much of it goes really in line with those projects as well. I will say that the Allied Health Group has over 100 members, but we meet on average 6 times per year. And we have approximately 18 to 25 people who attend the meetings. But the important thing, and it's always been very intriguing to me, is that even though we have about maybe 20% of the full list who attend the meeting, everyone stays engaged. If, for instance, an email goes out and someone didn't get it, I'm alerted. And so even though we don't have every person coming to every meeting, and all these meetings that I'm discussing have always been in-person meetings, we don't have people attending the meeting regularly, the Allied Health meetings regularly. They stay engaged with me through email. And so that might change as we move forward and we're able to do some in-person and some remote. I think our participation might change there. I will say that 2020 looked a little bit different for the Allied Health Group. We normally schedule our meetings a year in advance, and we schedule it in the middle of our region so that people who are coming from Franklin and Hampshire County can meet us in the middle. And we have it free of cost at the Bay State Whitney Ave Center in Holyoke. And this year looked a little bit different. We had our regular meeting at the beginning of the year, and then by March, everything changed. We canceled those all the meetings that were scheduled. And then we rescheduled a couple remote meetings where we focus on the long-term care workforce and everything that was happening across the state. And those meetings were really focused on exchanging information, asking questions, trying to find ways how to get students and graduates into the workforce, just really troubleshooting together. That's what our meetings were focused on. And then we also incorporated some of our healthcare workforce grant meetings under that umbrella as well. So even though the pandemic disrupted our calendar plan at the end of the year, we pretty much had the same number of meetings and accomplished pretty much the same things that we normally would have. And our Pioneer Valley Interprofessional Education Collaborative. So this is our newest group, and they've been around since 2013, and they were previously under a different name, and they were established through the Cooperating Colleges of Greater Springfield. And their purpose was to, with the changes in accreditation for many of the more advanced programs, the PAs, the OTs, the pharmacy programs, the accreditation required that they do interprofessional work, interprofessional practice, and they learn together. And the solution was for them to bring the colleges together across different campuses and to think about how to train their students in an interprofessional way. And they did this on their own for 3 years, but the struggle that they have is they didn't have the resources that the Workforce Board brings. And so my experience with the Pioneer Valley Interprofessional Education Collaborative becoming a part of the Healthcare Workforce Partnership is that in 2006, I received an invitation from one of our Western Mass Nursing Collaborative members to attend a evening dinner that the PVIPEC was hosting. And during the dinner, I sat at the table with a lot of the leaders on the PVIPEC group. And I found out that the purpose of me being at the dinner is that they were going to ask if they could actually roll their collaborative under a partnership. And we began discussions about doing that. And it turns out that much of the members, I should say, much of the member organizations were already involved in other work in the Healthcare Workforce Partnership. We had 2 additional schools that joined a partnership with this initiative coming under our umbrella. So we had Springfield College and Western New England University that became paying members of the Healthcare Workforce Partnership. And what I have on the screen are 2 events. So prior to 2020, all of our interprofessional activities were done in person, and we had large scale events, multiple events per year. And in 2020, we had to rethink how we were going to educate students in an interprofessional way across different campuses. And so we had to refigure the whole thing out. And so in October, we had an event across 3 different days. So October 20th, 21st, and 22nd, we had a remote interprofessional viewing of the film To Air His Human. And so we did that through Zoom, and we broke up the groups and made them into small groups, breakout sessions, and had discussion groups following the viewing of the film. That was very successful. We have our second event coming up since the pandemic in 2021, spring of 2021. So ordinarily, every year we hold an interprofessional interprofessional event, and it is done on approximately, I think, 8 different campuses and the hospitals as well. And we have students from all different programs, so nursing, OT, speech, audiology, all different programs. And we put them together in different groups, and they visit different campuses, they visit the acute care organizations, and they engage in a simulation event together. We had to rethink, how are we going to do this remotely? And so we worked as a part of the PVIPEC group, worked this past fall and developing this program. And we're actually going to do the simulation through Zoom. And we're going to use standardized patients. And we're going to kind of redesign the program in a way where it will be implementable remotely. And right now, I counted the number of participants. We're going to have approximately 270 participants. Previously, when we did it in person, we had a little bit over 300. So the Zoom account doesn't prevent us from having more. It's just all the programs with everything else that they have to deal with. It's just we won't have as many participants as before because of the pandemic and all the things that comes with it. And so this is the last slide that I do have. And this slide just really highlights some of our activities. And we have many, 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 many activities, but the ones that I put on the slides are pretty much the ones that occur almost annually. So we have the interprofessional education simulations, I just described that. And then we have the clinical placement system for nursing students. And I would say we do it annually, but we probably do it every month, every week, nonstop. This is something we work on continuously. We do have educational open houses, and what this looks like is that the healthcare organizations open up their facilities, and the educational institution goes into the healthcare organizations and recruit individuals to enroll into different healthcare programs. We have our regional website. We have our workforce gap analysis. I showed you an example of the medical assistant. And then we have the career pathway programs as well. And that looks like many different things in many different ways. One of the things that we've done recently is to actually host, we are on our we just completed our 4th webinar series yesterday, and we are presenting information to high school students on different careers in healthcare. And that is the end of the presentation. So I'm going to give us the ability to start our video and to unmute ourselves. Give me one moment. I am going to give us the ability to do that. One moment.
Well, while you're doing that, this is Karen again. I want to say amazing, amazing presentation. It's an incredible network, and I thought you did a fantastic job describing a little bit about the history and the structure. And we actually do have a few questions, a couple questions that have already surfaced. And I imagine after you, I think because we have some time, I'm going to ask you to allow the people, I'll call out the people who posted the questions and ask them to allow you to, wait, I'll have them ask you verbally because that makes it a little bit nicer. Is that okay?
Sounds good to me.
Okay, so the first question was from Ashley. So Ashley, you had a question about subgroups and whole groups. Why don't you unmute yourself and ask the question?
Yes, hi. Thank you so much for this presentation. I was actually, it was perfect timing. I spoke with Rebecca Lashman like 2 days ago, and she's like, you need to meet Peta-Gaye Porter. Like, you need to so talk with her, because I have recently taken over the Boston Healthcare Careers Consortium. You know, my question as I was listening and learning about your subgroups is, how does the structure work in terms of like, when you talk about your meetings, what is the overlap and connection points for the subgroup meetings versus potential whole group meetings? Do they typically, is that like only once a year that they come together as a whole group? How does that structure work?
So one thing is that our members do overlap for many of our groups. So our nursing group is specifically focused on nursing, and we have a strategic plan. So a lot of our conversation is really focused always around the same thing. So if you're not a nurse, and if you don't educate a nurse, and if you don't hire nurses, very rarely are you going to be interested in a conversation. I want to say that even last year, as an example, even last year when we reached out to long-term care, so they do hire registered nurses, and they hire LPNs, and I hire CNAs. When we reached out to them and say, what are your pain points right now? How can the Healthcare Workforce Partnership help, right? We had to separate the two discussions, because we're going to talk about RNs, and we're going to meet with people who are training RNs. And then we are also talking about CNAs, and we're going to meet with people who are training CNAs. And we had to the great thing about our meetings and the people who are involved in the meetings is that they actually are talking about the day-to-day programming of it all. You know, we're talking to educators, and we're talking to recruiters in the healthcare systems. So I think those are the things that helps us to kind of identify who belong to which group. I will say of the PVI-PET group, because of the nature of the reason why the group was developed was because they are required to, by their accreditation standards, to have interprofessional education. And so that's a requirement first and foremost. So we start thinking, okay, who in the system needs this as a requirement? And many of those people are individuals who need to have a master's degree, an advanced degree, before they can be hired in any systems. But then we started thinking, well, within the healthcare system, not just individuals who have the higher credentials are important. Everybody's important. And we start thinking, how do we start getting those people involved? And I think that's the way how we decide what our groups are consisted of. And I think sometimes too, they do self-select. So for instance, at one point, Holyoke Community College, they were one individual whose work is primarily focused on CNA training was responsible for training individuals who are CNAs in other countries to become, who are nurses in other countries become nurses in Massachusetts. And so now his work shifted and he became a part of our Western Mass Nursing Collaborative meeting until his work changed again. So those are some of the things that we do.
Okay, great, thank you.
So we have a question. Bodhi had a question about financing. Go ahead, Bodhi.
I did. As you showed us the MOU, I didn't actually notice if that was just for one of the collaboratives or for all of the collaboratives. And I was wondering if there were members who did not support financially, if you had individuals or if you had smaller training providers who participated but did not support financially.
I wanted to introduce everyone to David Cruz. You probably already know him. And I did want to, he's the president and CEO of the MassHire Hampden County Workforce Board. And David, I want to pass that question over to you.
Yeah, thanks, Peta-Gaye. And good morning, everyone. Thank you so much for making time in your schedules to join us this morning. I have a couple of thoughts that I want to share, once the gallery finishes its questioning, and thanks, Bodhi, for that, for that question. When we look at our structure here, pretty much everybody who is a member, particularly of the Western Mass Nursing Collaborative, is there on a paid basis. This is a leveraged investment model. However, if an institution or an entity wants to be a part of that discussion, we certainly don't use money as a barrier, and we certainly welcome and invite them in. We want them to understand that in order for this work to continue, that somewhere along the way, there has to be some type of funding. And as you all know, finding funding for capacity building is very difficult. It's hard enough finding funding for training. And this is why I know all of us in the gallery are so excited about Commonwealth Corporation making this funding available through the Healthcare Workforce Hub, because it's the first time in a number of years where we've had this kind of dedicated funding, but it's hard to get money for capacity building. So we do have this type of a leveraged investment model, but we do not say to a member institution, look, you can't continue to participate. We had an example this year because of COVID-19 and the pressures that were on the educational institutions around not having students on campus and having to forego room and board payments. That we had one institution who, just indicated to us that this was going to be kind of a bridge year for them, and that it was going to be difficult for them to, continue to invest at the level that they had been, but they certainly wanted to continue to stay involved in the meetings, with the understanding that once they were able to work through this particular fiscal year and this particular crisis, that they would, kind of get back into a regular formation. And decision that Peta-Gaye and I made was, look, that's great. The partnership felt comfortable with it. So, we're trying to be as inclusive as we can, but we're also, trying to face the reality in order to keep this work going, absent any state or federal funding, that there has to be some way to kind of co-invest in the model. So that's kind of the approach we take to it.
Great, thank you.
There were not any other questions that people posted in the chat. I want to open it up and say, please raise your hand or speak up if you've got particular questions. We definitely have more time for questions.
Yeah, I have a.
Yeah. Oh, so we'll go Milan. Oh, and I'm sorry, Dave, you wanted to share something else, and Milan. Then
yeah, I'd rather. Yeah, thanks, Kurt. I'd rather defer to Meelan because I know she was just about to say something, and I
Okay.
can certainly come in after that.
Okay, go ahead.
All right, thanks. Good morning. I just was wondering if you could talk a little more about what the board and the partnership did working on clinical placements for nurses and what that looks like this past year. And then also who the project manager for the partnership is, and has it been the same person since 2006?
No, so the partnership started with a different project manager, Kelly Aiken. Neelan, do you know Kelly Aiken?
I do, but it's from a past time frame, so.
Yeah, your name is unique. So I remember seeing your name. So I worked for Kelly as a project coordinator prior to Kelly moving on. So she was the original project manager. And yeah, she took the project from the initial phases and just made it into something where she could actually bring in additional staff and, guide me so that I could fill her role once she moved on. And so, yeah, my name is Peta-Gaye Porter and I'm the project manager. You ask about clinical placement for nurses, during 2020 and as a whole, both or?
Yeah, 2020 specifically, and then as a whole generally.
Okay, so I'll start with 2020. So pretty much in 2020, because of the pandemic, in our area, and I think across the state, all the students were booted out of long-term care. And that was pretty much everywhere in the state. However, because I shared earlier that all of our long-term care, all of our acute care agencies in Western Mass are a part of the Western Mass Nursing Collaborative. They've maintained relationships with our deans and our educators for a very long time. And so they were in a position in the first part of the spring when everyone didn't really have much information. So we were all in a position where everyone weren't able to go into acute care. But the conversations continued happening. That didn't mean that everybody went into their own corners and started doing their own work by themselves. We continued to meet, we continued to find solutions and to solve those issues throughout the summer. And so by the summer, for a lot of our organizations, clinical placements had opened up by the summer for acute care. And by fall, all of the acute care organizations opened up, and except for one that opened not until November. But I would say that what happened is that we just tried to work out the best way to get the most students in. And when I heard back from our acute care member organizations, they actually placed more students in number in 2020, in the fall of 2020 than in previous years, just really working with the schools, knowing what their needs are and trying to solve the issue of making those clinical placements accessible. And so what we did as a group was to look at the units where they could accept students, and then to take those student groups and to segment them out so that they had more students filling a single placement group. So that's what we did in 2020. On a whole, I talked about a centralized clinical placement system. Are you familiar with it?
Vaguely, but more information.
All right, so
better.
So DHE manages the online component of coordinating the clinical placement system for nurses. And we've been a part of the CCP for many, many years. I think many, many years. I think we started in 2008. And what we've done in our region is that all of our nursing collaboratives sit together in a room on a monthly basis, and we talk about clinical placements and education of nurses. And so this is ongoing work where we have standardized the process of how the placements are done. So what's done in Elms College is it's the same expectation of what's done at AIC. So all of the educators, we're all speaking the same language about what the expectations are for clinical placements in the healthcare organizations. And yeah, we've just maintained that. It's a beast. It's not easy, but we've managed for a long time.
Yeah, one of the things, Meeling, and this may be to a question that Bodhi had just asked, If you notice on one of the slides, and I know there was a lot coming at you in 30 minutes, and as Karen said, we intentionally wanted to leave us a little bit of time to have this type of gallery discussion. One of the nice features of this leveraged investment model is that all the partners have agreed that the payment, the annual payment that the hospitals, acute care facilities, and all the educational institutions that have students going on clinical rotation, they have to pay into the DHE clinical, the centralized clinical placement process. So rather than having each one of those institutions paying to CCP separately, as part of the membership package that we have with them, part of that funding that comes from them to us is used to pay for what they would normally be paying themselves to the Department of Higher Education. So we have the hospitals, we have the 2 and 4 year educational institutions. On an annual basis, CCP invoices them for a certain amount of money. But we only make we make a payment directly to the CCP on behalf of all the organizations, and that amount of money comes out of the leveraged investment funding that moves from them to us. So we become kind of a bank, if you would, where funding comes in, and part of that funding is used to pay for, as Peta-Gaye said, this clinical placement service that the institutions would be paying for themselves if they didn't run it through the healthcare workforce partnership. So part of the funding is payment that they could have made on their own, but it allows us to work collaboratively and do some stuff that we couldn't do if they were out making payment themselves. So that's a little sense of how the CCP works, but also how the funding, fits into that.
And if you want more information about the clinical placement tool that Department of Higher Ed manages, I'm sure that we could get you connected to the right person just to explain kind of how it works. And all of your local nursing programs in Massachusetts probably know about it. So you could be in the loop and kind of know what they're doing and how they're using it.
I just want, if I could, Karen, I just want to make a couple of quick comments because I can tell you 10 years ago, we weren't where we are right now. And on a couple of Peta-Gaye slides, you heard her use 4 really important words that I hope you'll all kind of leave with. And that's take the long view. This isn't a partnership that you can build overnight. It isn't a partnership that necessarily needs funding in order to either be created or sustained. And one of the nice features, I think, of the work that all of us are doing in the Hub project is that in order for us to do our work, we have to bring together our partners. And this may be for some of my colleagues in the gallery, the first time that intentionally you've been in a situation where you've brought these partners together around a particular goal and a particular project. That's really good. I think the thing you want to try to do is to see if you can begin to use this opportunity as a way to sustain in small steps this particular partnership. And one of the nice features about this Commonwealth Corporation funding that I know I'm excited about and Peta-Gaye is excited about is that if we are successful and are fortunate enough to get funding in phase 2, that funding, as you all know, is for 2.5 years. And this is a perfect opportunity as part of what you're going to propose for your phase 2 program. I know we're going to do it, is ways how we can improve our partnership. Because there are things that we'd like to do that, quite frankly, we don't have the funding for. We'd like to do a lot more activities around middle school students, in particular, around high school students. And we're hoping to do some of this as part of our phase 2 work. I also know that a lot of my workforce board colleagues are in the gallery. And, I was asked once, why is a workforce board involved in this work? you know, your funding is primarily from WIOA. You have a state workforce plan through your regional planning that kind of drives your work. And my answer has always been that one of the major roles that we as a workforce board play, as you know, is that of an intermediary. None of us do any training. We contract that training out to educational institutions and training providers. We are intermediaries. And this is a perfect example of how a workforce board can play that role of an intermediary, a convener, a facilitator. And I can only say to you that during the COVID period, I have sat in on a good number of Peta-Gaye's meetings, primarily so that I could learn and I could listen to the pulse of the region. And I can tell you emphatically, and those of you that know me know I normally don't say these kinds of things, that without this kind of a partnership, without this kind of a relationship, these institutions would not have had a forum to be able to not only exchange their challenges, but really to develop collaborative approaches that benefit both their institutions and in particular their students. And more importantly, benefit the patients. That really this at the end of the day is all about. So there's just some wonderful things that can be done, and the partnership doesn't have to be driven by money. It can be driven by a need to facilitate communication and to get partners into the room where they become not only colleagues and professional associates, but they become friends. And we've tried really hard to do that and continue to work incredibly hard at it. I would say to you, though, that having somebody like Peta-Gaye Porter to manage this work on a pretty much a full-time basis, you're going to have somebody who can kind of manage this work. It's too hard, it's too complex, it's too time-consuming, and in order to do it the right way, you need to at least be able to dedicate a little bit of staff. Doesn't need to be necessarily full-time, but I would just urge you, if you're going to try to take the partnership that you're now building in phase 1, keep that partnership going in phase 2 and beyond, you got to think of a little bit of dedicated manpower in order to do it. So let me just leave one more thing and then I'll stop talking. I wanted to, you know, whenever we've had the healthcare, our colleagues together here in Western Mass, I very rarely have a chance to meet with them on a regular basis, but I always say this to them. I always bring them back to the Patient Protection and Affordable Care Act of 2010. And as you know, the Patient Protection and Affordable Care Act became the landmark healthcare legislation. But very quickly, what it became is the Affordable Care Act. As we do so often in Washington, we monetized it. Then, as we so often do, we personalized it and we called it Obamacare. We made it personal. And somewhere along the way, particularly from what we've all gone through and continue to go through, we've lost the patient protection part of the original legislation. And to this day, I've always felt that what we should be talking about is not the Affordable Care Act or Obamacare, but the Patient Protection Act. That's what it was intended to do. It was intended to protect the patient. And one of the best ways that you can protect the patient is to be sure that the workforce that's working with the patient, either in a facility or in community health care or in home health care, has the skills and training that they need in order to really truly provide that patient protection. So this for us is kind of, for me anyway, the overarching theme of our thinking. And we always try to evangelize and socialize, you know, with our partners and keep them focused on the patient. And I would just say to you that everything you've heard today from Peta-Gaye around this workforce issue is really, at the end of the day, about how do we deliver high quality, cost-effective services to patients. That's really what drives our work. And I wanted to just say that just as an editorial, because I think it is an important framework to kind of look at when you're looking at what we all need to do in this really exciting 2.5 years we have ahead. And one last thing, please know that everything that we have, that we've developed over the years is yours. We don't have a copyright in any of this. We're willing to share it in any format you want. Like you, we have a very big cut and paste machine. We would urge you to use it. We don't take any ownership, any of this. We've worked hard to put it together, but we are more than willing to share any collateral we have. And both Peta-Gaye and I, particularly Peta-Gaye, is more than willing to provide any guidance and technical assistance that any of you might need in any of the work you're doing, because I know you would do the same thing for us.
I want to thank both of you for putting together this great presentation and for the offer to share resources. It's a couple minutes before 11, so we're going to have to wrap up. I would encourage any of you who want to follow up with Peta-Gaye directly to get more information or to get access to any of the resources or tools that she introduced you to. You should do that. And the other thing is, please take a look at the website that Western Mass developed, a healthcare website that's really a wonderful resource. There wasn't time to kind of go over that today, but it's a great resource that they've developed for their region and could be useful for any of the other regions. Just as an example, part of the development of it was supported at one point here or there by some grant dollars. So, we just remember that they pieced together the development of the partnership and the growth of the partnership over the course of years using lots of different funding streams, including some of the funding streams that you all are able to access through WCTF grants. So I would encourage you to talk with me as you're putting together your training plan to move forward into the second part of the HUBS grant about how you want to use or target some of the dollars to help support the development or the sustainability of your own partnership. And we need to think creatively for each of you about that. So thanks to Peta-Gaye and Dave again, it was really great. Okay. I have to jump off to another call now. You guys can stay on. Okay, bye.
Thanks, everyone. Great
Bye.
to see everybody. Be safe. Bye-bye.